Do you frequently feel like your heart pains sometimes? Or have you ever had a blood clot for no clear reason? Maybe you've had a miscarriage and don't know why. These could be clues to a lesser-known condition called antiphospholipid syndrome, or APS. Imagine your blood becoming too sticky, so sticky that it forms clots even when it shouldn't, like a straw clogged with thick milkshake. That's what happens in APS. It's not common, but when it is active, it can quietly cause big problems like strokes, heart issues, or pregnancy complications, often without warning. And the scariest part, many people don't know they have it until something serious happens. So why does your blood get too sticky in a PS? Well, think of your immune system like a security team. Its job is to protect you from invaders like viruses. But in a PS, this security team gets confused and starts attacking your own body, specifically parts inside your blood vessels that help control clotting. These attacks create antibodies, troublemaker proteins called antiphospholipid antibodies. They make your blood more likely to clot. It's kind of like if a guard started pressing the lockdown button all the time, even when there's no danger. Sometimes a PS appears alone, which is primary a PS. Other times it comes with diseases like lupus. We call that secondary a PS. Scientists don't know exactly what flips the switch, but genes, infections, or hormones might be involved. Now, how would you know if you have a PS? The symptoms often sneak up on you. Have you ever had a leg that suddenly swells and hurts like after a long flight? That might be a deep vein clot. Or maybe you got a stroke even though you're young and healthy. That's a red flag. Women might suffer repeated miscarriages, especially in the second trimester, because clots block blood flow to the baby. Some people get seizures, rashes that look like a lace pattern, or even sudden shortness of breath if a clot reaches the lungs. But here's the twist: some people have the antibodies, but no symptoms at all. That's why regular checkups matter. Catching it early can save your life. How do doctors find out if you have APS? It's not just one test. First, they check your blood for the antiphospholipid antibodies, but not just once. You need a positive test, at least 12 weeks apart, to confirm it's really APS and not a temporary reaction. They also look at your history, any clots or pregnancy issues. Imaging like ultrasounds can show clots in legs or lungs. Once diagnosed, treatment isn't about curing but managing, usually with blood thinners like warfarin or heparin. Think of them as detox for your blood, keeping it flowing smoothly. For pregnant women, doctors often add baby aspirin and heparin, safe for the baby, to prevent miscarriages. The goal: stop clots before they start. Can you prevent APS? Not exactly. You can't stop your immune system from going rogue before it happens. But you can prevent the damage it causes. Avoid smoking. It damages blood vessels and increases clot risk. Stay active. Sitting too long, like on long flights, can slow blood flow. Drink water and stretch your legs often. If you're on blood thinners, follow your doctor's advice exactly. Missing doses is like turning off your seatbelt. Women with APS should talk to doctors before getting pregnant. Planning ahead with the right care can lead to healthy babies. The key is managing risk, not living in fear. The good news: science is moving fast. Researchers are exploring better tests that spot dangerous antibodies earlier. Some are testing new blood thinners that work faster and have fewer side effects, like direct oral anticoagulants DOACs. But recent studies show they don't work as well as older drugs for some APS patients, so doctors are careful. There's also exciting work on biologic drugs, medicines that target only the faulty immune cells, not the whole system. Imagine fixing just the broken guard, instead of shutting down the whole security team. Trials are ongoing, and personalized medicine, tailoring treatment to your specific antibody type, might be the future. Hope is in the lab, and one day we may not just manage APS, we may stop it before it starts.